Good afternoon and welcome to this session. My name's Tara and I'm one of the trainers here at Exon Health. Today I would like to spend just over 30 minutes, maybe 40, taking you through optimising practice performance with surgery insights. Firstly, I've just got a bit of housekeeping. The call is being recorded today for sharing purposes. If you do have any questions, please do drop them into the Q&A box. So that's at the top of your Teams window at any point during the session. And I've got my colleague Dee, who's on the session as well, who will endeavour to answer your questions. And lastly, as we go through the webinar, Dee will be also dropping relevant links into the chat box as we go through the session, so watch out for those. Okay, let's get started. So we're going to have a whistle-stop tour of Surgery Insights, which is a collection of dashboards for GP practices and PCNs that are designed to optimise patient access and streamline operations, all in one place. So it provides integrated data streams. Now, this combines publicly available NHS data with live telephony and digital assistant metrics from Exon Health and third-party suppliers. We've also got operational intelligence. Now, this is a month-by-month view, and it explores relationships between data sets, such as comparing inbound calls against online consultations. And then we've got performance tracking. And this delivers regular updates on workforce, appointments, and NHS app usage. So typically reflecting the month-end position within 1 week of data availability. So the primary value of Surgery Insights is to help you move from reactive management to data-driven decision-making. So first of all, it allows you to optimise workforce capacity by matching staffing levels directly to patient demand, which helps reduce missed calls and identifies where administrative tasks can be shifted to digital channels. Secondly, it also provides benchmarking against national standards. Now you can compare your appointment volumes, your DNA rates, your consultation trends against national averages to clearly identify performance gaps. Finally, it helps you measure digital product adoption, and you can quantify the tangible staff time gained and the number of calls deflected by using tools like Surgery Assist, Omni Consultation, Surgery Intellect, and the NHS app. So ultimately, these reports give you the insight that's needed to bridge performance gaps and maximise your team's efficiency. So what can Surgery Insights show you? Now, as I've said, Surgery Insights acts as a central hub, and it consolidates your practice data into one unified dashboard, saving you from having to jump between different views to grab the data. Now, this also allows you to monitor critical performance areas, including operational demand, workforce capacity, and digital adoption. It also can help you assess patient satisfaction and experience, while providing clear benchmarks against national standards. Now, by bringing demand, capacity, and efficiency metrics into a single view, the dashboard enables you to quickly identify areas for improvement and make data-driven decisions for your practice. So after any changes have been made, you can see where these strategies are now clearly working well and making a difference. So beyond being a central hub, Surgery Insights is an integrated system. It's designed to grow alongside your practice. Whether you are using existing Exon Health tools like Omni Consultations or Surgery Intellect, or adding new features in the future, all your data will flow automatically into a single holistic view, And that does include third-party data where their access is granted. Okay, so we're just going to look at how to navigate to Surgery Insights. So if you are a Surgery Connect customer and have procured Surgery Insights, you can access the dashboard directly in the reports console. So via the phone bar or the SSO, which is the single sign-on web page. So this is the single sign-on web page where you can go into reports and access it from there. And this is via the phone bar here, and then your consoles here. If you're not a Surgery Connect customer, it can be accessed via a direct link. So there's probably most of you are Surgery Connect customers here today. So now I'm going to walk you through the detail and have a look at the tabs on Surgery Insights. Okay, so what I have here is the Surgery Insights screen. I've got a particular surgery, which is a real surgery, and I've anonymized it for data privacy. Okay, you can see we've got lots of tabs down the left-hand side. These are all the different dashboards, and also we've got the tabs exactly the same along the bottom. What I will do is in the welcome and the activity summary, I'll just show you where you'll find specific sections that will be repeated on the majority of the tabs as we go through them. Okay, so the welcome tab, you can compare your DNA rates, your missed call percentages and online consultation volumes against national averages. So you can see we've got the green and red indicators, green indicating that it's below the national average. This is where it's above the national average. Okay, so very easy to see. We've also got the NHS app, national average as well, and this is for registered patients 13 plus. You can see this particular surgery is 77%, so 2% above the national average. Then we've got the line graph here. Now this measures the monthly balance between phone calls, digital consultations and physical appointments. Now as you can see, as I move the mouse across the graph, it gives us specific data points which we can focus in on. Okay, and also we can see here, for example, this is where the online consultations were introduced. You can see 2024 11 they weren't, and then the next month they were. And then also if we move over to the right hand side, we can see Surgery Intellect was introduced here. Okay, so you can see the different patterns. Now, one thing I did want to show you is with the charts, if you look at the top right hand corner, we've got these options here. So you can filter and slice. Okay, you can pop on the focus mode, so it will enlarge the graph, and also you've got extra options here, so you can export the data, show as a table, etc. Okay, and you'll find that on the majority of the main graphs here. Then at the bottom you've got three more looking at the workforce full-time equivalent, your GP patient satisfaction survey, and also the number of practice registered patients. Okay, so if we move on to activity summary, again, there will be a few tabs that have the same look and feel as this one. Up here, you've got different views that you can look at. On the right hand side here, you've got your KPIs or your national benchmarks. And then here, you've got your main bar chart or graph. Again, we've got the options at the top, the filter, focus, and additional more options. And also here we have got inbound calls, online consultations, and then we've got the chatbot that was introduced here. Okay, so again, if you move the mouse up and down, you can see the different stats as we hover over. And if you click, you can see that we focus on that particular year and month, and the data at the top is just focusing on May 2025. Click on it again, and it will go back to the original dates. Okay. Now we are going to go down and jump to telephony. So here we've got 4 charts to look at, and all of them have got the slices, the focus mode, and the more options. Again, we've got the tables with different views where you can analyze them in more detail. And again, we've got the benchmarking, so tracking abandoned calls, missed from queue, etc. And again, we've got the red and green indicators. So again, also, as we move the mouse across, you can see we've got the specific data. Click, and it will recalibrate to the national benchmarking and comparison. Click again, and it will go back to the original dates. Here we've got the measure of the callback success, and then here we've got the wait and call duration. And then at the bottom, we've got the menu choices. So you can see these are the choices within the menus in the call flow. And at a glance, you can see that the appointments option is the most popular. Then it looks like general inquiries and prescriptions. So it could be that you want to pop add more staff into the appointments group to field those calls. Or you might want to put more information into the call flow about appointments, or you might want to implement check and cancel, that kind of thing. Okay. So next we'll go on to appointments. So again, we've got the different views to go into more detail, and we've got the benchmarking as well at the top. Now, this is giving you a visual on exactly where clinical time is spent from triage and routine care to acute consultations. Okay, and we can see we've got the legend at the bottom here. We've got clinical triage is orange, and then the blue is planned clinical procedures. You can home in onto 1 month as before. You've got the DNA appointments, and then number of appointments with the GP or other practices, practice staff like nurses and pharmacists. And again, you've got your filter, focus, and more options. Okay. Now we're going to go on to the NHS app. So again, we've got our different views. So you can switch between the views of uptake, the usage, messaging, jumps offs, and data table, and integrated services. Okay, this here will display the latest month's registration rate compared to the national average. So that this surgery is above the national average, and again we've got this graph that shows us we're above 2%. Okay, we've got a bar chart again with the registrations, and here we've got the organ donation activity. So this can track patient engagement with national health initiatives, including lookups and updates. Okay, we've got there. So now I'm going to go on to a few of the additional products that we've got. So the first one is Surgery Assist. This is the chatbot. and I just go through, that's it. It will only show if you're using the product. And Surgery Assist is our NHS approved digital assistant, and it's designed to signpost and educate patients towards appropriate healthcare and community services. And it reduces the demand on GP surgeries and increasing the usage of the NHS app and online consultation tools. It's a brilliant product and it's got great data backing it up. So if you don't already have Surgery Assist, Dee will pop an interest form link into the chat, and one of the team will be in touch to let you know more about it. So here we have the timing tab, provides a closer look at the volume of chats by days and hours. And also here, the AI questions provides you with detailed information on every question that's asked via the AI in the chat box. Okay, in the chat box, sorry. Then we've got measures of the total volume of conversations and the number of saved calls of those who've used Surgery Assist and didn't call back. And then we've got conversations and AI questions asked and answered, identifying out of hours usage as well. Okay, we've got the top intent, so appointments comes out top here, and also the AI user. So I want to book an appointment, that comes out top as well. So there's obviously a lot of patients wanting information about appointments. So if we now move on to Surgery Intellect, and again, this tab will only be visible if you are using the feature and you have purchased it. It will also appear automatically in your reports portal. Now, Surgery Intellect, powered by Tortoise, is our voice-enabled AI assistant that uses ambient voice technology to listen, transcribe, and code consultations in real time via the phone bar. And this is used with both telephone and face-to-face consultations. Now, if you don't yet have Surgery Intellect installed and you'd like to register your interest, there will be a link again in the chat box. We'll be happy to talk to you about it. And there also is currently a free 3-month trial that you could benefit from. Okay, so again, we've got the views at the top here on the left for more detail and also data tables. Here we have got the displays, which gives you the volume of outputs from the scribe, which is intellects, clinical notes, medical codes, and letters. Then here, one of the most interesting stats is a measure of time saved based on 15% of the audio duration. So currently that's set at 237 hours that has been saved. We've got intellects by month, and this is how staff are using it over time. And then we've got outcomes by month, and this is tracking the generation of specific clinical outputs. Okay. So again, you've got filters and slicers, you've got a focus mode, and you've got more options where you can export the data. Okay, let's go on to Omni consultations. Now, again, this will be only visible if you are using this feature, you've purchased it. If you have, it will also appear automatically in your reports portal. Now, Omni consultations forms allows patients to submit medical requests directly to your practice. This information is then compiled into responses, allowing your staff to easily manage the triage workflow. And the consultation form data can be gathered through a voice agent, a web form, and manual entry by staff. And that manual entry could be a patient speaking to them over the phone or face-to-face. Okay, now if we look at the top chart here, this provides a high-level breakdown of how patients are reaching the surgery. So here we have consultation method is the phone bar, and then we have got the voice agent here. Okay, so the voice agent is predominantly the consultation method. Then we have on the right-hand side the displays of the raw numerical count for each consultation channel. Okay, and then again, we've got the estimated time saving, and this estimation of clinical staff time saved is based on 2 minutes per consultation. Okay, we've then got consultations by date and by method, and it shows you the volume of consultations so you can track seasonal trends or growth by month. So you can see we had here on the 15th of June, there was a massive increase in voice omni responses, and that's probably on a Monday. We can see, yeah, generally, and also these 3 weeks as well. Then we have whether the appointment's been booked for the patient themselves or if it's been booked on behalf of somebody else, for example, a child or a parent. And then the severity and priority. So categorizing the clinical urgency of a consultation. Okay, we're going to now go on to online consultations. So we are jumping about a bit, but we are just going through everything that in an order where most of you will be using the tabs. Okay, so online consultations. Now, this report tracks the volume and type of online submissions received by your practice. So it's either via our Omni online consultation forms or a third-party service. Now, it also displays the resolution pathways of the online requests, helping you understand signposting and workflow effectiveness. Okay, so again, we've got the different views at the top and analysis for more detailed views. And then here we have the total number of online requests and how your surgery's volume compares to the national average. Okay, so this is lower than the national average, therefore is indicated by the red indicator. We've got the bar chart here. Again, we can click. It will give us statistics specifically for November, and we click again. We go back to the full date range. Okay, showing the volume of digital requests received each month to track the growth. So you can see it's been steady, and then in March, it's increased quite considerably. Then on the left-hand side, you've got the surgery's monthly digital usage rate against the national average trend. So you can see the national average, it's basically, it's following within 1 or 2 the national average. And then lastly, we have got the percentage split of requests between clinical, administrative and other categories. So we've got admin here and then clinical. So the majority being clinical consultation types. Okay, now we're going to go on to the operational efficiency. So this dashboard provides a data-driven look at how digital tools are reducing the admin burden on your team. Now, if the other reports a magnifying glass looking at specific tools, the operational efficiency tab is a wide-angle lens, basically, and it's where we bring everything together. So whether you're using Surgery Assist, InSelect or Omni Consultations, this tab calculates the cumulative impact across your entire product suite. Now, the data here adapts to you. So it automatically surfaces metrics for the specific tools that you have active in your practice, and it ensures the insights you see are always relevant to your specific setup. So basically, this tab is about quantifying the relief provided to your team. It also allows you to see the impact of your digital transformation moving from managing tasks to managing clinical outcomes. So here we have got surgery assist time saved by intent. Now this shows exactly where the chatbot is most effective. So tasks like appointments show days saved for admin staff. Okay, so we've got here appointments and hours saved, 97. Then we've got the statistics on the right hand side. These are summarising the overall impact and showing total minutes and days of staff time saved. Okay, and then we have the highlights of the days of the week where digital tools are most used. So you can see on the hours saved, intellect, and then assist. So the different products here. And as you can see, on Saturday and Sunday, assist is still saving hours because it works 24/7. Okay, so you can see, let's see if I can just hover. It's not going to let me. I think it was the last time it said 5 hours. There we go, 5 hours. So that's on a Saturday and a Sunday. Okay, and then hours saved by months. So now we're going to move on to the workforce and patients. Workforce and patients tab acts as the practice's capacity planner, and it analyses whether staffing levels are sufficient to manage patient demand. And by analysing your staffing levels alongside patient growth and national averages, you can make informed decisions about resource allocation and identify opportunities to shift staff focus toward proactive care and QoF outcomes. So again, as usual, we have the different views on the top left. So the patient view monitors total registered patients and those aged 13 plus, tracking month on month the list and the growth to help the practice plan for future demand and funding requirements. We've then got these set of statistics which tracks the ratio of patients per GP full-time equivalent. There we go. And full-time equivalent admin and patients per admin FTE as well. FTE meaning full-time equivalent. So those of you that may have a lot of staff that are part-time, 2 part-time may add up to 1 full-time equivalent. Okay. Then we have on the right-hand side monthly breakdowns of the FTE percentages, and it allows management to see exactly how staff composition impacts patient list management over time. And again, if I hover over, you can see I've got my options, the filter, focus, and export data, for example. And if I click on that has just, okay, we should be okay. Let me just see. And we've got the 2 bar charts here where we've got the FTE and we've got the headcount. So this is the physical number of people, staff in the practice, and this is the full-time equivalent. Okay, so it's visualising the total staff headcount and the FTE across different roles. And we've got the legends here down below. Now we are going to go on to the GP patient survey. So this is the newest tab that we've made available, and it delivers direct annual feedback from your patients regarding their experience of access, the quality of care received, and overall satisfaction with the practice. So again, we have the different views at the top left so that you can see it in more detail, and you can also make yearly comparisons and view it in the data table. We've then got a snapshot of the overall GP experience and ease of contact. And then here we can visualize the quality of patient experiences across different channels, so phone, website, and the NHS app, to pinpoint which services need operational improvement. So we can see at a glance how difficult it is to contact a GP practice on the phone. Over here, we've got very difficult, so nearly 20% have said very difficult. And the NHS app, if we have a look, not tried. So we've got 20% that have not tried the app. That might mean that you may want to pop some more promotion about the NHS app in the call flow. You might want to pop some posters up in the waiting room promoting the NHS app. And also here we've got the website, again, 20%. Okay, so here we've got last contact. This tracks exactly how patients attempted to contact the surgery and the outcome of those attempts. So for example, we've got 46% who phoned, and what happened when you phoned a GP on that occasion, 46%. Held in a queue, you had a call back, and there was, you didn't wait to answer. So between the held and the queue and call back, that probably looks at the phoned. Okay, and then how do you describe your experience of contacting? We've got very good, which is nearly 30%, to the very poor. So that might be where you would like to look into things. Then we've got the pharmacy and the services that the GP has provided in the last 12 months. So lastly, we have the resources tab. Now, right at the top, this facilitates the quick access to technical support and deeper documentation for all of the Exon Health services. On the right-hand side here, there's the transparency of the freshness of the data being viewed, listing the specific month and year of the latest updates for each module. Okay, and then at the bottom here, this audit trail maps every metric back to its origin. So whether from the NHS Digital's public data set or proprietary surgery systems, it ensures clinical and admin accountability. Okay, and then what I'm going to do now, we have the filters, so you can filter here, and I'm just going to go back to the slideshow. So we do have great feedback from some of our customers who've done just that and got stuck into the data and really analysed it. This is one of the quotes, so I'll just let you read through that for a couple of seconds. Okay. And then we'll go on to the Exon Health Academy. So I just wanted to make sure that you have seen the new academy that was launched at the beginning of June. We urge you and suggest you have a look into this because it has courses for every product and will go through insights as well and cover everything that I've covered today. And Dee will pop in the links into the chat box to it as well. Okay. Then lastly, we have got lots of options for additional support and resources. So we've got the help centre guides, the surgery insights, surgery intellect, and the Omni consultation reports. For more information on anything that we've talked about today, you can either email your customer success advisor, or you can contact us here in the training team on this email if you'd like to learn more about the reporting capabilities. And if you'd like to know more about surgery insights, you can just reach out through the contact register and register your interest. And Dee will pop in a link into the chat box. These are the links to the Academy modules as well. Okay. So thank you for your time today. We have got 2 more webinars over the next 2 weeks. Also, if you want a deep dive into any particular area, get in touch with your CSA and look out for the follow-up email, including the recording. So thank you very much and goodbye.